start, I'm very nervous. But you guys are friends, so forgive me if I'm a bit slow. Here's one thing I know for sure, that every mother deserves a chance to watch her kid grow. It has been the fact that has sort of pushed me in the direction of what I do today. And I really believe that birth, the process of giving birth and of raising children, should be a happy event for a mother. And the idea that thousands and thousands of women in our continent do not get the chance to watch their children grow affects me in a deep way. It is a personal thing. It's almost like a personal affront. I don't know where it comes from, but I'm going to try to make sense of it through this talk today. Nothing about where I was born could have predicted that I would be in front of you today to tell you this story. I was born in a very small southwestern town, actually, in Nigeria. It's called Ilaorangun. Even Nigerians don't know about it. So I was born in Ilaorangun and raised by two teachers. The fact of their life was that they needed to ensure that their children were educated, probably like all your parents. They worked so hard. They gave up so much. Sometimes they even gave up their personal dignity just to ensure that these children they had were well educated. When I was about 14, and a series of happy accidents sort of brings me here today. The first accident of my life was that I was born and raised by such amazing people. The second was when I was 14. My mother literally won the lottery. So the United States had this program where they put a bunch of names together, and then they pick one, and they give you a green card and an opportunity to bring your family to the United States. My mother won that. And that gave me an opportunity to get educated and to sort of know more about the world. So I lived in the US. I went to high school, I went to college, I went to graduate school, and I really, really enjoyed my time. And then there was what I called the dark years. Quite a lot of first-generation African children in the West, I didn't know where my place was in the world. I didn't know if I was Nigerian, I didn't know if I was American, I didn't know where I should live while I grow up, what work I should do. So there was about 2 years of me just struggling seriously about my place in the world. I found Nelson Mandela's autobiography. And what I got from Nelson Mandela's life was a sense of duty to your community and to your people. And that duty is not easy. It doesn't look like a superhero movie where you found out you're supposed to do something and then you do it and everyone claps for you and it's perfect. I love those movies. But the sense of work, what it takes to actually bring your vision to reality is work. And it's hard work. It's work emotionally, it's work financially, it's work physically. And that it just takes a lot. So I knew that I needed to do something called my duty. But what is my duty? So I started traveling. I got an opportunity to work in northern Nigeria. So I stayed between Abuja, Kano, Kaduna, and Jigawa. So I was just traveling around that part of the world. And the next accident of my life happened there. In a small town in southwestern Kano, I met a young girl called Aisha. Now, Aisha, when I met her, was in labor. And she had been in labor, as they told us, for 3 days. So what's interesting about Aisha's story was not that there is a high maternal mortality rate in Nigeria. 54,000 women died every year in childbirth at the time. So that was not interesting. That the fact that Aisha was going to be one of the statistics one of those women who died was not what was most interesting about her story. What was most interesting was that she wasn't a victim. She wasn't a victim. She was waiting for someone to help. She was helping herself. She was struggling. She held on in pain. As a mother myself, I know. She held on for 3 days, just waiting. She was waiting for someone to come and help, to just give her a hand and create the infrastructure she needed to get a simple surgery that would save her life. After I met Aisha, she lived, thankfully, but a lot of times when you have these talks like this, the person will say, after I met Aisha, I went back to the continent, I built an amazing health system, I saved 1 million people, and everything was great. But that's not what happened. For me, I didn't want this work. I didn't want to do it. And what I found out was that your story only actually makes sense in hindsight. That it's not a linear thing. That sometimes you go back, sometimes you go forward, sometimes you pause, take a roundabout to come back to what your vision and what your life's work is. So I traveled. I went to Geneva. I lived there for a while. I went to East Africa. I traveled. To me, I was waiting. Something else needed to happen to push me to do this work. And I needed to sort of find a personal affinity to the work that I feel like I have been called to do. And then I became a mother myself. So throughout this process, it was extremely difficult. I had a very long labor. I almost died. My child almost died. But what was so interesting about, and what was so different from Aisha's story and mine, and throughout the labor, I actually thought about her, was that I had access to excellent health care. I didn't have to wait for 3 days to get the simple surgery I needed. And that simple fact saved my life and my child's life. So I knew I had to do something. I came back home and launched something called LifeBank. So LifeBank is a company using technology to build a new infrastructure for the health system. We build apps, and we use automated intelligence, artificial intelligence. We use data to figure out who will need certain things, who will need blood, which patient will need plasma, which patient would need platelets, which patient will need oxygen. And we figure out this thing out and give the probability into the hands of the healthcare provider. And the other thing is we move what they need to the hospital on time. I'll tell you a personal story of how this company is doing amazing things in the continent. A young mother, a few days before I came for this, for TEDx, was in labor, and she had given birth, and they didn't know that she was bleeding. And in the fast-paced health system in Nigeria particularly, but in the rest of the continent, often they're not actually paying attention like the way they should. So she had been bleeding for quite a while. So she had about 30 minutes left. So they called us. Somebody had heard about LifeBank on Twitter. They sent us a message, "Can you help?" And we were able to move the blood she needed to her within 25 minutes. So so her life was saved. Now, LifeBank doesn't really always save mothers. We work with everybody. But a story like that, about something that I started, sort of got me to think about Aisha and my story and the story of mothers across the continent. And that's what we're doing. I believe that every single African deserves access to the best, the most efficient, the most effective healthcare that we can deliver to them. And that's my life's work. Now, before I leave you, I will say something. As an American and as a Nigerian, there's something that is going on in the world. The Western world they're moving towards isolation. they're less open, they're less liberal than they used to be. And what that tells me is that there is an urgency, a great urgency for us to make a continent, I won't say great again, but to make our continent work, to make it work for the vulnerable, for the weak, for the mothers, for the children, for all the Aishas in our continent. Thank you.